Hi, this is Dr. Gombele from drg.com. Hola amigo, ¿cómo estás? Mi nombre es Dr. Gombele. Ah, mon ami, comment ça va? Je m'appelle Dr. Gombele. Banamboka, Monganga Gombele, Dokotolo Gombele, Makamuzari Makasiao. Thank you very much for coming to our first series of the videos that we have planned for you in this YouTube channel. In my last introduction, it was indicated to you that it promises to be motivational, inspirational, and educational. And we ended the series by telling you that today we are going to talk about what is diabetes. And I told you that diabetes is not all about sugar. Yes, sugar is one of the problems, but it is not all about sugar. Chasing sugar, we are chasing the wrong guy. So, Dr. Gombele, what is diabetes? To understand what is diabetes, we have to understand the organ called pancreas. Pancreas is an organ that we have in abdominal cavity that secretes an hormone called insulin. In fact, it also secretes other enzymes for other purpose of digestion. But for the diabetes, hormone called insulin is the one that is secreted by pancreas. Insulin serves as a key that goes to open the doors of the wall so that after we have eaten, when the sugar goes up, because everything that we consume in our body breaks down to sugar, starch, bread, rice. Whatever you eat breaks down to sugar. But that sugar gets trapped in the vessels. In the vessel, the sugar may not be able to get into our body. So what insulin does, insulin goes, open the doors so that the sugar can exit the vessel where it can be used in our body as source of energy. What happens with diabetes? There are issues with insulin. Either the pancreas does not produce insulin at all. If there is no production of insulin, that means there is no exit also of sugar from the vessel. That is called type 1 diabetes. Or pancreas produces insulin. Very good. But when the insulin goes into the wall to open the doors so that the glucose or sugar can exit the wall, get into our body, the body starts resisting. It's like you put a key and the key just keep on spinning, the door not opening. That is called insulin resistance. These two are the main problem that cause what? Diabetes. So when insulin cannot open the door of the wall so that the glucose can exit the vessel, get into our body, and we continue eating, drinking, the sugar starts piling. For type 2 diabetes, that process can take 20, 30, 40 years before the sugar gets at a level where we start having symptoms. But for type 1, it is a matter of days or week before we have symptoms. So that being said, now we have it set that sugar is a result of diabetes. It is not diabetes itself. What is diabetes? Diabetes is insulin resistant for type 2 insulin. How many types of diabetes are there? Before I can go further, I'm inviting you to like, share, subscribe, and click the notification bell so that the very next video that I'm going to upload, you can be notified. How many types of diabetes are there? In my book, Diabetes in Lifetime, I discuss 5. Now we know very well when we talk about diabetes, the guy in trouble here is insulin. Either is not produced at all, or the pancreas produces insulin, but for some strange reasons, the body does not allow insulin to do its job. What is the job of insulin? I repeat myself. The job of insulin is to let glucose exit the vessels, get into the blood, get into the body, where it's going to be used as a source of energy. How many types of diabetes are there? I'm going to just mention 5. 1, type 1 diabetes. This is when, as we indicated earlier, the pancreas does not produce insulin at all. Maybe it produced last year, 6 months ago, but was some problem that happened in the body. The beta cell, which are responsible for the production of insulin, they become destroyed, and they get destroyed rapidly. And then you just realize that you start getting thirsty, you start losing weight, you start drinking a lot of water, you start rapidly losing weight. That means the sugar pile up in the vessel, and then when you go to the hospital, they check, the sugar is high. This consists of 5 to 10% of all diabetics, type 1. It is diagnosed from age 0 to 21. But now we're also seeing that even some adult population, they are being diagnosed with diabetes type 1. This is not insulin resistant, this is lack of insulin. Diabetes type 2. Here is where the pancreas is producing insulin normally, but the insulin just cannot do its job. And it is called insulin resistance. This is type 2 diabetes. It is not called high blood sugar. No. If we ask a young medical student, what is type 2 diabetes? And if they say, oh, it is too much sugar in the blood, he's going to fail the exam. Type 2 diabetes is nothing than insulin resistance. The World Health Organization now has categorized type 2 diabetes as a lifestyle disease. What do you mean, Dr. Gombele? Type 2, yes, it is a disease that is caused by the way we eat, by the way we drink, by the way we exercise, by lack of this, lack of that, and that lead to the problem of type 2 diabetes, also known as insulin resistance. And we said when the insulin cannot get the glucose out of the vessel, the glucose starts piling up. For type 2 diabetes, the process can take 10, 20, 30, even 40 years. So for those who want to reverse, if it took 20 years, 30 years to develop diabetes, there's no quick fix. It takes time to reverse. There is also type 1.5. What is type 1.5? Type 1.5 is nothing than just type 1 diabetes diagnosed in adult population. Here, the cells that secrete or produce insulin are not destroyed rapidly and in type 1. It takes weeks. Here it may take months to years. In fact, most of them are diagnosed type 2. But what happened? Quickly, they cannot respond to oral medications. And we have to put them on insulin because type 1 diabetes treatment is insulin. Type 2 treatment could be medication, lifestyle, and we're going to talk more into that. What is the other one? Gestational diabetes mellitus. Gestation, this is pregnancy. Gestational hypertension, pregnancy causing high blood pressure. Gestational diabetes is a lady who never had diabetes before, develops diabetes during the pregnancy. What happened? changes of hormones in pregnancy make the body resistant to insulin. And as a result, there is a piling of glucose in the vessels. Then again, this is also another lifestyle, because 80% of ladies with gestational diabetes, lifestyle modification can help them to have a normal baby, a normal deliveries. Or they have to be on insulin because the diabetes must be controlled. If not, then it might affect the product. The last one that I spoke in my book is drugs-induced diabetes. Yes? Oh, yes. Drugs-induced diabetes, mellitus. I prescribe a drug to treat a medical condition. Unfortunately, I'm getting result by treating this medical condition, but side effect of that drug is what? Diabetes. So we have to see what is the most important now. Is diabetes or the treatment the disease that we are dealing with? And sometimes we just treat the diabetes and we continue prescribing the same drug. But I'm going to pause here to focus most on type 2 diabetes, because this is the most prevalent of the 5. It consists of 90 to 95% of all diabetics. Can you imagine? The easiest one, the lifestyle one, is the most prevalent. Is it good news that we can change our lifestyle and then get back to normal? Did you know that? No? Okay. What are the let's say the signs and symptoms of type 2 diabetes? Because you remember, patient will not come to me telling me, Dr. Gombele, I'm diabetic type 2, just write me a prescription. My job will be very easy. But unfortunately, they do not come that way. They come with complaints. They come with a problem, and they tell you the problem, and you have to add from examination and history that you take and send them to do the test, and then the result will come and you tell the patient what is wrong. Patients come with losing weight rapidly, or they are drinking a lot of water, or they are passing a lot of urine. Sometimes they get up in the night 20 times to pass urine, and sometimes they go right through the day, bathroom, and they say, Doc, I am tired of it. Or a wound that's not healing, or some discharge somewhere. So you listen, and then you send the patient to do some tests. That's signs and symptoms. What are the risk factors to develop diabetes type 2? Dr. Gombele, what are the risk factors? Risk factors, as I say, risk. More you have them, more likely you're going to develop diabetes type 2. I want to split them on modifiable risk factors and non-modifiable risk factors. Modifiable that we can modify, non-modifiable that we cannot modify. Let me start by non-modifiable. We'll continue. Risk factors. Age. The older we get, more likely we are going to develop diabetes. Some people say race. Some race are more prevalent to develop diabetes. Family history. What's your family history? If you have diabetes in your family, more likely you are going to develop diabetes. These are the risk factors that we cannot modify. We have no control over. But listen now to the modifiable risk factor. 1, lifestyle. What do you mean by lifestyle? Lack of exercise, lack of activities, diet, right? Can we modify lack of exercise? Yes. Can we change our diet? Yes. Obesity is the most single important risk factor. Can we decide to lose weight? Yes. So these are the risk factors. If you have diabetes in your family and you want to reduce the risk factors of developing diabetes, watch out those risk factors I mentioned. Lifestyle, lack of activities, diet, you eat everything, you eat a lot because in your family everybody is big boned and this and that. No. Diet is what makes people fat, and 99% of fat people is because of what? Of diet. So when you change the risk factors, you also reduce the probability of you developing diabetes. Listen, before I can continue, I'm inviting you to like, share, subscribe, and click the notification bell so that my very next video that I'm going to upload, you can be notified. Complication of diabetes, numerous. It affects all the organs of the human body. Diagnosis, that leave it to the doctor. But the good news here for type 2 diabetes that it is a lifestyle disease. That means when you change the lifestyle that led you to diabetes, subsequently you are reversing diabetes. Is not this a good news? Did you know? In fact, today, a friend of mine came 3 weeks ago, sugar all over the place. I put him on a diet. Today, he told me fasting 7. 3 weeks ago, fasting was 15, 18. He just changed his lifestyle. And then subsequently, I'm also going to change his medications. So I didn't take him off his medication. But as the sugar goes down, we're going to pull him off his medication. This is the channel where you're going to fight back. Diabetes can be beaten. Type 2, the more prevalent, the one that you have to learn how to fight it back, is the one that is caused by the way you eat, by the way you drink, by the way you do your exercise, by the way you eat, by the way you sleep, by the way you do everything, because that's what lifestyle is all about. So diabetes type 2 can be reversed, and this is the more prevalent, the most prevalent type of diabetes. Type 1 in children, 5 to 10%. Type 2, 90 to 95% of the diabetes population. Gestational diabetes, pregnancy ladies. In the state, up to 18% of pregnant ladies will develop gestational diabetes. But that's not only that. When they have the baby, sometimes it reverses, but in the near future, they develop diabetes mellitus type 2. Drug-induced diabetes, we treat one medication, we treat one medical condition with X drug. Unfortunately, that drug as side effect is what? Diabetes. So, this is today's good news. Diabetes type 2 is reversible. Chasing sugar is chasing the wrong guy. We have to chase what causes insulin resistance in our body. The treatment for diabetes now, this is the matter that I'm going to talk in my next video. How do I eat? What is there for me to eat so that I can reverse type 2 diabetes, which is nothing than a lifestyle disease. So we are saying this, that diabetes must stop and you must fight back. Ndeko, au revoir. Amigo, hasta luego. See you soon. Mwana mboka. Nakumona yo sikoyo. Bye bye.